Karissa, I'm so happy to turn the stage over to you. I love the fact that you are the mother, very proud mother of two girls who are about to be nurses. But of course, on top of that, you have a very fancy title here as Senior Vice President of Administrative Solutions and People, right? Thank you, Karissa.
Thank you, Bonnie. And we are so happy about our relationship with Daisy, especially in workforce management. So anyone who does have our mobile app knows that you can actually nominate a nurse within our mobile app. And it's something that we're very, very proud of. So thank you so much, Bonnie. So today we've talked about a lot of things. We've talked about the symplr operations platform. We have talked about how it impacts patients. We've talked about how it impacts functions and how everyone needs to come together. And now we're going to talk about what I think is the most important piece, and that's how healthcare operations technology can enable the employees who care for the patients. So with that, I'm going to bring up my esteemed panelists, Brad, Ekta, and Tracy. And Tracy got the memo on the outfit, the black and white. I mean, Ekta did. And you're
black
close,
and white
Tracy.
panel.
Black and white panel, that's right. So did Brad. All right. Could you all introduce yourselves, where you're from, what system you're from, and a little bit about yourself? You want to start, Brad?
Good afternoon, everyone. My name is Brad Schenk, Executive Director, Innovation and IT Business Applications at Houston Methodist. I've been with the organization 14 years. I've been in healthcare 20 years. I'm excited to be here today because my entire passion is to really, I know it sounds cliche, people, process, technology, but it's really to make healthcare smarter so that it can be more human. Quick background of where my passion derives from in the last 5 years is a family member who was diagnosed with late stage 4 cancer, given a very, very, very short opportunity to live. I experienced 3 years, 3 months, 3 days, and ultimately a positive outcome, which we're blessed for. But during that journey, I became a patient's family member, a caregiver, and I got to see 45 days and nights inside the walls of the hospital. So it really empowered me to do more. So I'm excited to be here today to talk a little bit about some of those things that I was able to participate in.
Thank you. And Tracy?
Good afternoon. I'm Tracy Goslin. I'm the Chief Nurse Executive at Memorial Sloan Kettering Cancer Center in New York City. I've been there 3.5 years. Prior to that, spent 28 years at another organization. My clinical background and love is oncology nursing. So when we talk about people, relationships mattering, especially with our front line, I think it's a critical piece, and I'm excited to be here on this panel, so thank you.
And Ekta?
Good afternoon, everyone. Thank you for waking up, not sleeping off, right? After lunch panel. I'm Ekta Vyas. I am the Chief Human Resources Officer for Keck Medicine of USC. This is the health system of the University of Southern California in LA. The health system, as of now, comprises of 4 hospitals. We are academic medical, certainly associated with USC. So 2 acute care hospitals, Keck Medical and Norris Cancer Center, and 2 community hospitals and over 100 ambulatory locations. In a lot of news articles, we've been written as one of the youngest, fast-growing health systems. So the progress and the growth that the health system has seen in the last decade is just unbelievable and very impressive. I have been with Keck Medicine, now nearing my 3rd year anniversary in July. But my experience in healthcare has been close to 2 decades, 14 years with Stanford Healthcare and Stanford Children's Health in Palo Alto, and then about 2.5 years with UC Davis Health in Sacramento, off the total career span of 28 years, so mostly healthcare. I did not come to healthcare with intention. I was more into academia. I was at San Jose State University. I'm an IO psychologist. and really was more about research and management consulting. Healthcare happened to me when Stanford just called me and hired me for their transformation that was going on there. But I pretty much knew within my first year that I'm not going to any other industry. And here I am, and certainly have a very big personal story also with my husband, having gone through 2 liver transplants. When the first one failed, his body didn't accept it. And then he was on life support for 3 days, and then went through another transplant, was successful, is now overcome 6 months after post-transplants here with me at the conference. So certainly I've seen that whole, what healthcare offers, and hearing the nurse's story, I've just gone through that experience and very appreciative of where I am.
Thank you. And as you'll see, we've taken 3 people from 3 different areas within a hospital system. So we have technology, we have clinical, and then we have HR. And what we want to explore today is how all of those areas really intersect to be impactful for the employee. So I'll start with you, Ekta, with the first question. And the question's, what's the biggest challenge that your team members are facing today?
I'll have to go back to the conversation around fragmentation that's been going on since this morning. I think that's a challenge that we have throughout the healthcare industry. For my less than 3 years at Keck Medicine of USC, certainly, I walked in knowingly that they hired me as a transformational change agent. That's basically a reputation I've built by just ended up leading transformations. But the combination, I think the specific challenge that my organization has, is the combination of growth, because we're ambitiously growing, especially on the ambulatory side. Growth plus transformation, right? I mean, a lot of the times we use the terms interchangeably, that growth brings transformation, but the matter of the fact is, what I've seen is when you are established in a certain way, and then you start going through mergers and acquisitions, right? And the industry, the external environment is changing very rapidly, right? It becomes like a double, the challenge is doubled, because you have to now integrate in a different fashion than how you would have integrated 5 years back. My biggest challenge as I stepped into a health system role was really so much fragmentation, that when I started leading the workforce integration, which we've just completed, the EIN W2 transition, our deal with our newly acquired hospital in 2022, 1st of July, they became us. We're Methodist Hospital of Southern California, and now USC Arcadia. And I was on board 11th of July, and that was my topmost priority. And as I started looking at the integration, what we need to do from a workforce perspective, I realized that it was really reintegration of entities that were already existing, because there was no playbook about how you operate as a system, right? And that goes to technology, that goes to policies, that goes to processes. And when you start calling out systemness, right, we are a system, there are certain expectations that come with that. So leaders would reach out to me, and have business cases of how there's no alignment, right? And there's no equity in the process, and why do we call ourselves system? I had the similar issue on the workforce side. Our systems were disparate. So honestly, that whole alignment that you need for a workforce strategy with the business strategy was kind of, from my perspective, missing. And we undertook a very massive system-wide HR transformation effort that is now in its 3rd year. We're wrapping up phase 1 of HR transformation. And the entire goal was really to transform the workforce management part through processes, policies, technology, everything, and implement a new HR operating model. So certainly, it's a very long story for me, but I do want to hear from other panelists. But that whole journey of how do you go from fragmentation to systemness, creating systemness, and integration at the time in different parts of the organization have their own transformational change going on, has been really the biggest challenge for us.
Thank you. What about you, Tracy?
I would say, listening to everybody today, we are all with the same issues, just at different places. So whether that makes you feel better or feel worse, you have a lot of other people ahead of you who can help. I would say one of the key things, so we have sites in New York and New Jersey. We have over a dozen sites of cancer care. And one of the key pieces, especially when you lead a department of nursing, you know intrinsically you are the largest department. So it's always like, okay, what are they going to ask for next? And I think being aware of the fiscal headwinds. We are a research-intensive institution, and I appreciated hearing the story of MedStar this morning and what they are dealing with federal workers not being able to get care when you don't have health care insurance. Those headwinds affect all of us. So then when you think about where is your staffing coming from? New York City, highly competitive market for patients, highly competitive market for nursing. So for us, some of the pieces we've done around staffing, I've been there only 3.5 years. I don't think it was just me. We are singular mission. We are a cancer-oriented institution, much like a children's hospital. So some of our recruitment, retention, turnover does not look the same, and some of it does. So one of the key things is reinforcing your academic practice partnerships. What's in it for you? What's in it for me? Shoring up that piece of the ship for your staff, rounding and hearing their voice. But I would also talk about workplace violence. Where I was before and being in New York, there was probably a few moments where I'm like, I'm in New York City, the Statue of Liberty, the melting pot. This is worse than when I was in Durham, North Carolina. So when I think about that and how we support staff, and I mean all staff, I'm not saying just nursing, verbal abuse, physical abuse, not as much, some of it's expectations, and some of it's probably unrealistic expectations. So those are some of the things that I think about, the fiscal, the staffing, and then the workplace violence that I truly do believe leans into the burnout and moral distress that nurses face and other team members.
So I would say from an innovation perspective, innovation should not be a burden on people. It should be an enabler of individuals to be more human and to have that human touch. I'm so moved by what it is the Daisy Foundation does, and I recognize, that bedside nurse. Again, spent time there, and it was the most connected that I felt. But people resilience is a strain. It's we're moving so fast. We're putting in so many new technologies. We're asking nurses and everyone to do so much more, and there's only so much resilience. You can ask of them during COVID, but where is the break? Where is the reprieve so that they come back? There wasn't any. We had to keep pushing, and then we move into the modernization and transformation of all of our technologies. We're asking people to do things they hadn't done before, and of course, they say, yes, I will do that. It's that people resilience component that I want to ensure, at least with my part and how I play, that we make sure that is that the technology that we're enabling is received well. Because if it's received well, then it pays forward. The entire purpose of adding the new technology is to take weight off of that individual who's trying to provide, whether it be an back office individual who's trying to support someone on the front line, or it's the front line. And so, I look forward to sharing with you some of the things we're doing with our newest hospital, where a culmination of all the technologies that we brought together, we placed in one hospital, and with a goal of making it smarter and more human.
Thank you. In recent years, healthcare workforce challenges have really been in the headlines quite a bit, as we've all seen. Can you provide an example of how your organization has made some operational changes or technology investments to support teams and address the staff shortages and retention issues? And Tracy, I'm going to start with you.
So one of the great things about being new at an organization is humble inquiry and asking questions. Tell me, show me. So early on in my tenure, I learned we were doing some things around falls. So what did rounding help me understand? I had beds maybe that didn't have bed alarms. Major fleet replacement. And they were like, why would you ask for that? What we did was perfectly good. I said, well, maybe not good for everyone. Our teams need tools that work in advance of us finding someone down the road, potentially on the floor. I think the second key piece, I've been a prior Epic user. We just went live with Epic February 1st. We used multiple parts of it. When I say going and seeing the work, right, the Gemba walks, all the quality, continuous improvement, and I say to an ambulatory nurse, right, early on, tell me what happens when the patient emails you in the portal. And she would show me, well, I copy, I paste it, I send it to the provider. Oh, very good. What happens next? Oh, I get an email back. Very good. Show me next. Then I put it back to the patient and I said, what is your source documentation? She goes, oh, then I print the email, I get a label, and I make sure we get it scanned. I'm like, wow, this is fantastic. What a process. So Epic is hard, right? It's all about workforce, it's all about change. And so helping people understand, I'm like, we're gonna have some things that aren't gonna go well. I know that. We're gonna have some things where we will help. And so it was really important, hindsight's always something, and having used the system before. And so the nurses, probably about 4 or 5 weeks in, we're about 2.5 months in right now, they're like, it's all in one place, Tracy. I'm like, I know, isn't it great? The other piece is we learned from our patients. And I think that's the other piece where technology helps. So it might be a big investment, such as an IT solution. It could be something as simple as beds, right? And the alarms that they need.
Now, I have to ask, did you think of the falling because of when I fell on the stage a couple minutes ago? Is that what made you think of that?
I am looking at this table that I feel like I need to straighten up just a little bit, right? There are some things in my life, but...
Could have been a workers' comp claim right there, BJ. I'm just saying.
False.
Yeah.
Clumsiness does not get you workers' comp.
I don't know.
Are there any lawyers in the room?
Yeah.
You have an HR person sitting here.
Exactly. You've got my back, right, Ekta? Yeah. Brad, what about you? Any investments that you've made around operational technologies to support the team and address shortages?
Well, we hope so. It's a 5-year bet. Really, when we think about this, it's using technology ultimately to enable caregivers, to enable individuals to do more. We don't want to remove the human aspects of it, as I mentioned. So, if you were here last year, I mentioned, that one of the things that a mentor taught me a long time ago is the removal of a dissatisfaction is the equivalent of adding a satisfaction. Taking away something is actually positive. So we talk about that in the tech space from rationalization of applications, but how do we talk about that every day when we're talking about labor, when we're talking about people and what it is that they need to do? I mentioned to you I spent some time in the hospital, and it was rewarding because I was able to see what it is the nurses do, and along the way, hear things that they didn't want to do anymore. And so as we think about that hospital of the future, we made a lot of bets. We made a lot of bets of what it is that we were going to use technology to free up individuals. I'll give you 2 examples. One would be ambient listening, and we think about ambient listening in a lot of ways, whether it's note-taking, whether it's scribing, et cetera. But imagine a nurse, a very busy nurse, needing to come into the room and asking from the call button perspective, how can I help you? Oh, I need a glass of water. And the nurse makes 300 steps to go get the glass of water and comes back. And then someone says, oh, you have a need in room 20. So you go to room 20, hey, what do you need? And it's a blanket. It's those steps. It's that time that it takes. Now imagine ambient listening, and the patient is actually then able to say, I'd like a blanket. And when the nurse sees you for the first time, there's a blanket. Not only is it great because it was really thinking about what it is that the patient needed, putting that patient at the center and being able to deliver that more quickly, but it's also giving back time to the nurse and 300 steps times an entire day, right? So really thinking, in those terms. Another example that I would give is RTLS, and so we brought in real-time location services a while ago. This is to track, and I'll put it in the right order, things and then people. And that's by intention. It's easy to implement this type of solution to say, where is this asset? Where is this device? In our newest hospital, we came in with a brand new thought, and that was, how do we badge all of our team members with the focus of putting the patient at the center of this. So now imagine you're a groggy patient and you wake up and you're wondering who was in my room, and you look up, and rather than seeing a scribbled on, dry erase board with a green pen that saw its last day last week, but imagine now crystal clear, there's a photo as clean as what's up on the board here, and the patient's able to reference that. What it is that's giving the human component back to the nurse to be able to have a conversation, not answer questions that are predictable, not answer questions that could have been predicted. And so, really thinking about that technology and how it is that we enable that to give time back, to give that care back to the employees, hopefully removing that burden and giving more so that they can focus on why they got their degree and why they came into care in the first place.
Are you giving tours of the hospital of the future? Because I think maybe people might want to see that sometime.
We have believe it or not, we have a virtual tour on our website. You're able to see a lot of that tech, but
Awesome.
If you'd like to be a patient, come on down.
All right.
So we certainly have, I think every institution, every organization, the whole capital planning process is one of the largest processes. I co-chair with my CFO colleague a subcommittee for the capital planning process where the initial assessment's done, and certainly a lot of technology, advanced technology is brought forward for our consideration almost in every part of the organization. The two that actually I would want to highlight on the clinical side, certainly one where AI has been brought in more to support the physicians, right? And I think the whole generative AI from the transcription perspective to free them up, for really the clinical time that they've signed up for. That's actually really, really getting very good results and engagements for us, and that's more on the physician satisfaction, physician engagement side. And it's just been there. It's pretty new for us, about little over than a year, but we are continually soliciting feedback and expanding it. So we've not done a lot with AI, but we have a strategy, an AI strategy about how do we go about deploying that, even from a quality perspective. The one that I would want to highlight, again, in my CHRO role, it's really, a big component of that is the HR technology. What are you bringing to make the life of the caregivers easier so that they can spend time for, patient care and patient outcomes and not get bogged down with their day-to-day needs, and similarly for the leader. So we certainly, of the four big pillars that are part of, that are foundational to the system-wide HR transformation that we rolled out 2 years back. One is, digital human resources, digital HR. And, for everybody in the room, we're not on symplr. So again, that says a lot about symplr, who reached out for me to be on the panel, right? We're on Workday. And we actually took our latest acquisition, Arcadia, away from API, which I saw this morning is now yours, moved them from API onto Workday. But the technology side of the digital HR transformation is really, believe it or not, regardless of the fact that we are a very premier medical institution, the HR side was quite behind on the technology component. So the two-prong approach that we have is really employee experience as well as the leadership experience. And one of the latest wins we have had is launching the HR Business Center, which is centralizing all of the processes throughout the system for HR. Now, within Workday and outside of Workday, streamlining through lean process improvement. We are applying Kaizen for almost every area of HR process improvement. And through that, really implementing ServiceNow and telephony. So it's just been 2 months we've launched it, and it's just unbelievable the kind of workforce and leader feedback we have in how this has impacted a day in a life for them, for now having that centralized mechanism. Now, again, a centralized HR Business Center is a reality for a lot of the organizations out there. It's really how are you operating that? Because I come from a system which was a large system, and it was there, and it was the biggest pain, right? So it's not whether you've centralized it and whether you're using technology, it's really how you're deploying it to take away the pain, not to make it a pain in itself, right? So that's one big thing. On the nursing side, a very, very good technology investment we made was bringing in the self-scheduling system through an AI-enabled technology. And we are slowly and gradually now deploying it. Not all nursing units have deployed it. It's selective, and it's slowly and gradually deploying, because I believe the nurse leaders have to look at whether that particular part of nursing lends itself to self-scheduling. But there was a lot of noise. We are heavily unionized. It's California, right? So initially, when we were going to deploy it, we had the CNA, the nursing union, really, really expressing a lot of concerns about you're taking away the nurse's judgment, right? And kind of giving that to an AI functionality. And there needs to be a lot of awareness and education in regards to what that technology brings, right? It's not taking away a nurse's judgment. It's supporting that. But once we had deployed it, the self-scheduling systems really helped a lot. And a big shift in our operating approach was allowing more 10 to 12-hour shifts. And nurses always like that flexibility. They like the time off, and especially in peri-op and ICU, right? So that combination of the changing the process and the operations, and allowing for more 10 to 12-hour shifts, along with the self-scheduling, has really gone a long way. We've been very proud of very low turnover and very high retention rate. Even Becker's published a paper on how we've done it at CAC Medicine, and we have been carrying that for close to 2 years now. So a lot of wins.
That's great. Congratulations on that. And then lastly, I'll start with you, Brad. If you could prioritize one operational investment in the next 5 years to better support the healthcare workforce, what would it be and why?
I would prioritize digital personalization. That can span the gamut: back office, front worker, so many things. Down to, it does not sound, I'll use the term sexy, but we implemented a new digital workplace, aka an intranet, with the intention of providing individuals their information at the right time to pay it forward. So think about the efficiencies there. When you think about being in, whether it be your EHR, your EMR, symplr, any solution that you have in front of you, and you're different than the person next to you, different from the other worker. So to me, it's digital personalization at a hyper-personalized level that provides predictive needs to you. I think that's what I would, how we get there, I don't know. We'll look to symplr to help us with that.
Yeah. That's a good one, actually. We'll have to, Scott, we'll have to talk about that one. Yeah. Tracy, what about you? What are your thoughts?
So some of you might remember or have seen the Institute for Healthcare Improvement had a model put out probably well over 10 years ago called Finding Joy, right? And part of it is focused on addressing the pebbles in the shoes of the front line, right? My pebbles, your pebbles look very different than what we expect of our front line, who are seeing more patients, more volume, with increased acuity and complexity. And so I think it first starts with going to the clinician base and the non-clinician base they partner with to say, what does this mean for you? And then what are the processes we need to fix, right? Engaging people in dialogue in this way. I have a sneaky suspicion some of them are digital tools. We know we're getting ready to roll out some digital tools. Yet, I don't think the digital tool is about me and my rollout. The digital tool is about how does it help you and how does it help you actually solve that problem? Because I think sometimes the disconnect, we choose to invest the money, but maybe really aren't solving the problem. And I think that's the important piece to understand. So if we're trying to return joy and meaning and mattering to work for patients, right, of those that we're caring for, I think we have to, it's hard with everything right now, I think every organization's facing, but I actually think it goes back to asking the people and then working through your priority matrix and what that looks like. So I think digital tools are definitely on it, but when you hear basic stories, well, we didn't have a microwave, I'm like, seriously? Now, I made that one up, that is not one of my stories, but I will tell you there are those moments in your life where you're like, those things matter. When you got 12 staff trying to heat their lunch up, just go buy the microwave, right? And so what are the just do-its and what are the bigger things?
This actually came up, Dan, earlier with us, where it was around a chair. Same exact thing. They listened to their employees and replaced a chair. So it's so funny. Ekta?
Yeah, I'd actually go back to your first question where you said, what's your biggest challenge? And I started with fragmentation, honestly. So again, if you're talking about how do you address that challenge, right? Again, how do you address fragmentation? So my focus area, and I think for all of my colleagues and peers right now, is developing more interconnectedness and systemness, right? And it's a very heavy lift when you talk about an organization that's growing fast and integrating new organizations, but reintegrating those that have been already there for 10 years, right? Where you have to kind of look for scalability, get out of the outdated technology, embrace new technology, but look at your continuous growth, right? 10 years from now. So where's the scalability? I think that for us, when we talk about interconnectedness and systemness, certainly the digital function plays a huge role, right? Because data transparency and moving away from silos. I have, of course, people is a huge component where you have the accountability. But from the perspective of running a function, right? I have like Workday, and then there are like multiple technologies that interface with that one core HRIS function. But finance has another, and supply chain has another, right? And when you think about a person's day in a life at the institution where they're kind of dealing with like 50 different technologies, if there's no interconnectedness and systemness, you can imagine what that day in a life is for that person. And then how that permeates all the way, cascades down to influencing the culture, right? It fragments the culture when that experience is different. And I think to the last thing I would add, from the perspective of it actually has to go through processes, strategies, and technology, which is what we are doing at every level of the organization. But the whole academic, medical, and community tiers, the reality and the ask of community physicians is different than the faculty physicians. And then when you are a system that has those tiers, like how do you break those barriers and give everybody the feeling that they belong to the system the same way, right, as their peers? So it's a huge undertaking, but I think that, if we do it with the right strategy across technology and processes and your 5-year or 10-year strategic roadmap and get the alignment in your top leadership, I think, half of the battle is won, and that's what we are trying to do.
Great. I want to thank the three of you for joining us today. Thank you so much for your insights. We very much appreciate it, and thank you so much.